Hi, Monica.
Hi, how are you?
I'm good. How are you?
Good.
All right. So, how have you been since we met last?
Great. Same old, same old. I actually just got back from a wedding.
Oh, how was it?
It was fun. I was a bridesmaid, and I've never been one, so it was actually pretty fun for my first time.
Okay. Now, how were the festivities, the celebration, reception afterwards?
Super great. It was a beautiful venue.
Oh,
hmm
good. And how was the festivities?
What do you mean?
Was it open bar? Was it
Yes, it was open bar.
okay?
hmm
And how did we do?
Um, Not so great. Uh, I drank more than I planned to.
Mm-hmm.
Nothing bad happened. It was a great time, like I said. I just didn't stick to our plan of drinking less.
Mm-hmm. Okay. Well, thank you. I do appreciate the honesty in
Mm.
sessions. It's an important part of therapy. Um, And all I will say is that, weddings and holiday celebrations, those are some tough times for individuals who struggle with alcohol use. Um, so, again, thank you for the honesty.
Mm.
Um, I know that we had spoken last week about taking an assessment today, and I know that you signed the informed consent. Uh, the assessment that we're going to look at today is the Michigan Alcohol Screening Test, or the MAST for short. Do you have any Are you anxious? Are you nervous for it?
I'm a little
How you feeling?
anxious. I hate tests. So,
Yeah.
yeah, and it's about my drinking habit. So, that's also a little bit more anxiety inducing, for sure.
hmm Well, don't feel nervous. Don't feel anxious. I mean, we know that everything's going to be confidential, okay?
Mm.
And keep in mind that this is just one assessment. So it is not a gold standard. We have to take what it says into account, but it does not define you. The results don't define you, okay?
hmm
With all that being said, are you feeling ready for it?
Yeah, as ready as I'll ever be.
Okay. Alrighty. Well, then we can begin. I'll ask you these questions out loud and just respond to the best of your ability with yes or no answers, okay? Do you feel that you are a normal drinker? Normal being defined as you drink as much or less than most other people.
Yes.
Have you ever awakened in the morning after some drinking the night before and found that you could not remember a part of the evening?
Yes. More than one occasion.
Okay. Does any near relative or close friend ever worry or complain about your drinking?
Yes.
Okay.
Sometimes.
Okay. Can you stop drinking without difficulty after one or two drinks?
No.
Do you ever feel guilty about your drinking?
Yes.
Have you ever attended a meeting of Alcoholics Anonymous, AA?
No.
Have you ever gotten into physical fights when drinking?
No.
Has drinking ever created problems between you and a near relative or close friend?
Yes.
Has any family member or close friend gone to anyone for help about your drinking?
No.
Have you ever lost friends because of your drinking?
No.
Have you ever gotten into trouble at work because of drinking?
No.
Have you ever lost a job because of drinking?
No.
Have you ever neglected your obligations, your family, or other work for 2 or more days in a row because you were drinking?
Yes.
Do you drink before noon fairly often?
No.
Have you ever been told that you have liver trouble, such as cirrhosis?
No.
After heavy drinking, have you ever had delirium tremens, severe shaking, visual or auditory hallucinations?
No.
Okay. Have you ever gone to anyone for help about your drinking?
Other than you? No.
Have you ever been hospitalized because of your drinking?
No.
Has your drinking ever resulted in your being hospitalized in a psychiatric ward?
No.
Have you ever gone to any doctor, social worker, clergyman, or mental health clinic for help with any emotional problem in which drinking was a part of the problem?
No.
Have you ever been arrested more than once for driving under the influence of alcohol?
No.
Have you ever been arrested even for a few hours because of other behaviors while drinking? And if so, how many times?
No.
Okay. All right. Now I'll just need one moment to gather all these scores.
How did I do?
Um, 1 second. Okay. So your total score was a 7. Okay. And on this scale, 6 or more points is categorized as a problem drinker. So you get a 7. So you are right there, just a little above the chart here. And now, how do you feel about that here in your score?
Seems pretty high. I have been working on it.
Oh.
Obviously, I'm not at my goal yet, but I guess it's not as high as it can be. So.
Okay. And again, just remember that this is one assessment. So there's others that we can look at taking if you feel that it is accurate and that there may be some more problems due to drinking. And we can also take this again in future sessions and see how you've progressed. Okay.
Yeah.
Any other thoughts, comments, concerns?
No.
Do you feel that it may be accurate?
Yeah, only because there are times I do slip up and I do have a past with alcohol, so it'll definitely show up in my results.
Okay, fair enough. All right. Well, and just remember, we'll be working on these things throughout the duration of our therapy sessions together, okay? This is something that's going to be continuous, all right?
Yeah.
So don't lose hope, don't lose any, keep your courage. You've been doing well over the past few weeks. Now let's say for next session, I'd like you to talk to your parents, maybe about any patterns of alcoholism that may be in the family, okay?
Okay.
All right. So thank you for coming in today. I appreciate it. And I'll keep this, again, it's confidential, so I'll keep it in your file, all right?
Okay.
Refer back to it.
Sounds great.
All right, Monica. Well, thanks for coming in today. I appreciate it.
Nice to see you again.
Pleasure as always.
Hi, Eric. How are you?
Hi. I'm all right. How are you?
Good. Nice to see you again.
Good to see you too.
So, since the last time we spoke, how have you been?
I've been okay. I've been all right.
Have you been doing any activities outside of home?
No, I didn't really get the chance to go out this past weekend. I was, I'm a homebody, but no, I didn't go out much. I just stayed in and watched some TV.
Okay. So we have been talking in the past about your issues with anxiety. So I think it is important that you do go out of your comfort zone and try new things. Okay?
Sure.
Okay. So for today, I have the scale we were talking about last time, the Hamilton Anxiety Rating Scale. So I'm just going to tell you a little bit about it so you're more comfortable, okay?
Okay.
So each item scored on a scale of 0, not being present, to 4, being very severe, with a total range of 0 to 56 in scoring, okay? There are a total of 13 questions.
Okay.
So we're going to get started now. So the first is going to be dealing with anxious mood. So, have you been experiencing worries, anticipation of the worst, fearful anticipation, irritability?
Uh, yeah, I would say 4.
4. Okay. Have you been experiencing feelings of tension, startle response, move to tears easily?
Um, let's do a 2 for that one.
Fear of dark, strangers, being left alone, animals, traffic.
Let's do 2.
2.
2.
Insomnia, difficulty in falling asleep, broken sleep, unsatisfying sleep, and fatigue on waking dreams.
Yeah, I would say 3. Yeah, it's hard to fall asleep.
Do you experience difficulty in concentration or poor memory?
Not really. Concentration sometimes. So let's put a 1.
Depressed mood, loss of interest, lack of pleasure in hobbies.
Let's put a 1. Well, yeah, maybe a 2. I don't go out as much as I used to. So let's put a 2 for that.
Have you been feeling pains, aches, twitching, stiffness?
Yeah, let's do 3. Let's say 3.
Have you been feeling a blurring of vision, hot and cold flushes, feelings of weakness, and pricking sensation?
No, I would say 0.
Have you been feeling pains in the chest, throbbing of vessels?
Yeah, 4, 3 or 4.
Pressure or constriction in chest, choking feelings, sighing?
Yeah, I typically feel it in my chest. I would say a 3.
Have you been nauseous, vomiting, looseness of bowels in any way?
No, 0.
Have you been development of frigidity, premature ejaculation, loss of libido?
Yeah, I would say my sexual appetite has gone down quite a bit. I'll say 2 for that one.
2. Okay. Lastly, have you been experiencing dry mouth, flushing, tendency to sweat, giddiness, tension, headaches?
Tension and 2.
2.
Yeah.
Okay, and I'm just going to add up your scores.
Okay.
So you received a score of 36. So this is in the moderate to severe rating of the scale for anxiety.
Mm-hmm.
So I think it'd be better if in our upcoming sessions we do work on that. It's important to get out of your comfort zone and to try new activities.
Mm-hmm.
So how do you feel about your score?
Well, you said that the highest was a 56, right?
Yes.
So that's pretty high up there. I'd say it's definitely accurate. I do have, anxiety attacks and panic attacks pretty regularly, a few times throughout the week, especially at work. So yeah, I could see. I would say it's probably a pretty fair score.
Well, this is just a starting point. We're just starting therapy, so this is very normal to see. We will be taking this again at the end of our therapy sessions as weeks go by.
Okay.
And then we will see the progress that you have made. And you never know. It could go down. It may go up. But it's just important to stay on track of your goals.
Okay.
Okay?
Yeah.
Okay. Then I'll see you next week for our upcoming session.
Okay.
All right. It was nice seeing you, Eric.
All right. Thank you.
Yeah.
Appreciate it.